Thank you for taking the time to learn about and prepare for your upcoming delivery and discharge from the hospital. In this video, you will learn what to expect related to discharge planning for you and your newborn. Preparing to bring home a new baby can be both an exciting and overwhelming experience for all parents, even if they already have other children at home. Ideally, this preparation begins long before the baby is due. Infants who have been exposed to substances before birth may have additional needs once they are born, and it's important for parents and caregivers to actively participate in the discharge process. Federal regulations also require that all infants exposed to any substance during pregnancy have a plan of safe care to support the whole family prior to going home. One of the most important components of a plan of safe care is identification of a primary care physician for the baby. This can be done prior to the baby's birth. Upon arrival to the hospital, you will be asked to provide the name of this doctor or clinic. Once a discharge date is identified, you will be asked to make an appointment for your baby to be seen within a few days of going home. This appointment needs to be made prior to discharge and is part of ensuring your baby continues to be healthy. Similarly, it is important that parents and caregivers also have their medical follow-up appointments scheduled as well. This is a good time to make sure all follow-up appointments for the family are scheduled. Some infants exposed to substances before birth are at increased risk for neurodevelopmental delays, meaning their brain may be slower to develop and they may not meet developmental milestones like babbling or cooing at the expected time. Their developmental progress should be monitored after discharge to ensure the right supports are in place to promote healthy development. For this reason, your child might be referred to early intervention or another community program that supports development through ongoing follow-up after discharge. It is very important to go to these appointments because early assessment and treatment of any developmental issues can greatly improve your child's outcomes. In addition to identifying follow-up providers, it is also crucial that parents and caregivers have the knowledge, skills, and resources to care for their baby at home. This includes building and demonstrating the necessary skills of caring for your baby and having a safe home environment for the baby. When possible, at least 2 caregivers should be identified to learn the necessary care of the infant. This can include parents, grandparents, or other family or friends. As part of discharge planning, you will likely meet with a social worker or caseworker during your hospitalization, who can help support you while in the hospital and the transition to home. You might even have a caseworker or home visitor who will continue to meet with you once you are home, and they can provide ongoing support and help you identify community resources as needed. For more information about preparing for discharge, including connections to additional supports, speak with your healthcare provider. Thank you for taking the time to learn about how you can prepare your family for discharge from the hospital.